right. Again, thank you for everyone. I appreciate you guys coming, so that way we are informed, educated, and we know exactly how to use our coverage. We have Dr. Cam here from Auburn University Medical Clinic. He's one of our awesome doctors. And we have Dr. Witte here on behalf of Dr. Flowers. She's with our graduate school, if you have any questions for her. Dr. Peden, he's here for a student pharmacy. And Miss Fisher from LeeOBGYN. We also have Mandy, United Healthcare Student Resources on the very top over there. She's there. Yeah, she's working and helping our students out. So we'll go ahead with our questions.
I'm not sure if I introduced myself. I'm Jenna Bloemer, and I'm representing the Graduate Student Council. Hello everyone, thank you for coming to the session. The purpose of this session is to allow for a discussion of insurance-related questions with our panel of experts who have taken their time out of their busy day to come be here with us. So, about a month ago, the Graduate Student Council sent out a survey to graduate students to better understand a number of topics, including knowledge of common insurance terms, use of services, and also some common issues that the students are having. So based on the written comments and the feedbacks we received from there, the Graduate Student Council developed a list of questions for our panel. And we hope that our panel of experts can help us to clarify some of these questions from the survey. And at the end, once we go through all of those, we will open it up for questions from the audience. Just a reminder, if you have a very specific issue, it would be better if you make an appointment with one of our representatives so that they can handle it on a one-on-one basis. And just a reminder to our panel, please do use the microphone because we have a number of participants on Zoom who are watching the video, and they won't be able to hear unless we use the microphones. So you can just pass it along, and whoever feels like they can answer the question can go right ahead. So the first question is, could you briefly explain how the insurance premium cost is determined? And for the students in the audience, the premium is just that amount that you're paying at the beginning of the semester so that you can join the insurance.
Maybe I should give that to Mandy, but let me give it a quick, Greg. Okay, so how is the premium determined? At one point in my life, I ran an insurance entity. And so I understand it from that side of the world. Basically, you have someone who's called an underwriter that works with an actuary, you very smart math people. And what they do is they generally take 2 to 3 years of claims coverage. And in some cases, they also take into account the present year. But many times when premiums are being decided on, they don't have a full of the present year. They may only have, in our case, they'll have 3 or 4 months, typically when we will ask for a premium review. So, you know, the plan starts, and I'll be specific of the United Student Health Insurance, plan starts like about in August. By the time we ask for a premium review, they'll be running that in December or January. So they've only had a few months in the present year. But they're going to go back and look at the last 2 to 3 years of claims that they have paid and claims that have been filed. And I don't want to get too complicated. Bottom line is an insurance company, they're taking in money and then they're paying out money. If they're paying out more than they took in, they lost money. If they paid out less than they took in, okay, they may have made some money after they took out the administrative costs and all those things, right? But that's how they do it. They have a mathematical process. So I'll give you a classic example. Let's say in 2017 to 2018, the subscribers under the United Student Health Insurance, 14 babies were born, okay? Whereas the year before that, it was only 7. So 7 one year, year 1, 14 the next. The underwriter is gonna look at it because now we are in year 3. How many are we gonna have this year? We had 7 in year 1, 14 this year. What's it gonna possibly be in the present year? They've already calculated that when they gave you the premium. what's it going to be next year, which is what they're asking to quote on the premium for the next year. So, you know, if we're lucky and you have a larger historical analysis, and this is where Mandy comes in, she can point out to the underwriter, guess what? You know, we had 7 in year 1, we had 6 the year before that, and 5 the year before that. This 14 is just a very unusual year. And so she's going to push on the underwriter to say, you know, let's not hammer it. Why is that important? What do you think is the cost to deliver an average baby for the full obstetrical care and the delivery in the United States? Any idea? 2,000. 2,000? We wish. Any idea? How much?
50,000.
50,000. Okay, so it's about 30,000. Okay, so the average cost to deliver the day of the delivery and stuff, it's going to run in the 10 grand range. But there's prenatal care, there's postnatal care. The total cost is going to be in the $30,000 range. How much do you pay premium on average per year? $2,000. That's what you pay the insurance company, $2,000. So again, for one baby, okay, one baby, whoever that person is may have paid $2,000. The insurance company is going to pay out $30,000. So $28,000's got to come from somewhere. Well, men are not having babies, so hopefully we're going to pick up the they're going to pick up the $28,000 from those premiums. Okay, so for one baby, $30,000, we need 15 people paying premiums. Okay, just to cover the cost, we need 15,000 people paying premiums, and because that person only paid $2,000, right? So you got to have 15 people who didn't use any other health care to cover that one baby. Well, you can understand why an underwriter goes, what is going on in that situation, because he needs to, again, mathematically figure out what is possibly going to be the number of babies. And I'm just picking babies. It could be heart surgery, it could be cancer, it could be bigger ticket items, okay, bigger ticket items. And they can't come back to you and say, hey, you know, we want more premium. You know, they've already set the premium for the year. They're going to have to factor in next year.
Yeah, I think the bottom line with it is basically the premium amount is based on what is spent on the plan. If all of a sudden at the end of this year, everyone stopped going to the doctor, everyone's perfectly healthy, next year our premiums would be significantly lower. Obviously that can't and won't happen. UHC is legally allowed to only make a small percentage on the premiums collected. So if they make 50%, they can't make it legally, they can't. So just to let y'all know how that works. Do you want to expand on anything, or we cover it?
Yeah. And there is an insurance committee, so it's not just like 2 people or something. There is an insurance committee that about 20 people on the committee that I go to and present every year. And we talk about benefit adjustments. We talk about things that went good in the plan, things that didn't go so good. Your voice is being heard by the grad students, by the International Student Office, and they come and bring those thoughts and comments to us. So we really take a long time. It's about a 3-hour meeting. We have a long time that we go through this to make sure that we're giving you the best benefits we can and that you're getting the fair price that you need. So it's more than just a one-shot deal.
And one other thing I'd like to add, Mandy, what's your book of business average increase for the last 3 years? Any idea?
Probably about 28% overall.
So she's saying that average insurance premiums increase by 28% every year. Overall, for the past 4 years, I ran it the other day, it's 1% that it's increased for y'all for the past 4 years. So y'all are doing a really good job of utilizing the current resources, but I just want to let y'all know that. I think it's pretty important to point out.
Thank you. The next question is there an insurance discount for graduate assistants with Auburn? And if so, where is that shown and how much is that?
Is that the subsidy for insurance? Yes. So the subsidy is a benefit. If you are a GTA or a graduate research assistant, the graduate school will provide a subsidy for your insurance. What this means that on your bursar's e-bill, that there will be a GRSB, which is what Amy mentioned earlier, that will be reflected. That is going to be a total of $900 a year, but you're not going to see it in one lump. You're going to see it in the fall. There'll be a $450 subsidy in your account, which means being deducted, and a $450 amount in the spring semester, which will cover the spring and summer, right? So that subsidy will be on your bursar's e-bill, and it'll be under the graduate school fellowship, but it's GRSB.
The next question is whether the graduate school is exploring any options that would allow for an increase in the subsidy for graduate students on assistantships.
Okay. And I wish Dean Flowers was here because he is passionate about this topic. He wants to provide more coverage of this and is working with those here on campus to make this happen. So the subsidy will increase to $985 this coming year. So as of fall 2019, instead of $900, that total is going to be $985. But that means that in the future, it will be 50% of the insurance premium will be part of that subsidy, right? So this is a good progression. They're going to continue advocating. Everyone here wants to make those costs come down for you. You are here as a graduate student, and we value that you are here, and we would like it to be the best experience possible. That's why I'm so happy that you all are here. So they're going to continue advocating to provide more of a subsidy, more of a benefit, and with a goal of 100%.
Thank you. Another question that came up on the survey was whether it would be possible for students to pay the premium in a monthly bill instead of in a bulk cost at the beginning of the semester.
Absolutely. So this has been discussed with the graduate school, the insurance coordinator, the financial services, because they feel that this is feasible. This is possible to be able to do this. They're still working out on all the details, but no final decision has been made at this point. But that's the goal, is to have that available to you in the future. So but nothing at this time, but that's the goal, working towards that.
Thank you. The next couple of questions is mostly for the student insurance office. So the first question is, what is exactly the role of the student insurance office, and when should students come to you versus going to UHCSR?
Thank you for the question. Anytime that you guys have enrollment issues, find me. Anytime you have insurance questions, find me. Kara is also available. And again, she's at the very front. She's our new insurance coordinator. And anytime you have a claim processing issue, if you need a PRA for us to discuss, we got a healthcare to help you out with this claim issue. Also, if you need an EOB explanation and just to guide you to know how much of your deductible was met, what wasn't met, or are you in network, are you out of network? We always invite you guys to come to our office to be sure that you can enroll and say, hey, or you can log into your My account, and that way we can both look at it together. United Healthcare Student Resources is working towards making it to where we can guide you through your My account, so that way we can be like, hey, if you go up to this portion, let's look at your claim together. That way you and I can talk and figure this out. So it's not, you're not on your own. You're always there. We're always there for you. If you have any questions, again, we provided our information is on the brochure as well. Please feel free to contact us at any time.
We also wanted to know if there's a way that students can double check and make sure that they're enrolled in the insurance plan.
So when you log into your My account, you can see if it's active, great. If you see a bill on your e-bill, then let us know if you are not enrolled correctly. If not, please come to us again, and we will work with you and backdate it, whatever we need to do to make sure that your enrollment is correct. Yeah, that's right. Next question.
The next question is, are students able to opt out of the UHCSR insurance, and is there a deadline, or can they opt out anytime that they obtain different coverage?
You can opt out. We don't recommend you to, but that is unavailable as long as your insurance is equal to or better than ours. If you're international, I definitely would prefer you to stay with us just because we know how to explain your coverage. If you opt out of our insurance, I cannot help you with your claims. I can't help you with your coverage. I can't help explain anything. So I definitely recommend that. If you're a domestic student, you can go through AU Access under student. At the very bottom is student waiver insurance. If you're an international, you can come through to our office and fill out a waiver form. But I definitely recommend you stay with our insurance. But if you, like I said, if you find something equal to or better, then that's on you.
So as a follow-up question, say I paid for my insurance in January and it's supposed to go through the summer. Well, maybe in May, I get a new job, I get new insurance. Do I get a refund on the premium, or is that just a loss?
We can just end your insurance at that time. If you have used United Healthcare student resources at any point, I cannot go back on that. So whatever day your new employer begins, like if you were hired on May 1st, we can stop it June 30th. And then I'm not going to refund you for the times that you were enrolled, but I can stop it and then, take the charges off your e-bill. You can waive out. I would recommend you guys waive out no later than August 1st. That way we can make sure that we don't enroll you in our insurance. And then you can, that gives you a deadline. So August 1st would be good. And that applies to your fall enrollment, and that also applies to your spring and summer enrollment the following semester.
One more follow-up question on that. Are there any differences in the conditions in which international versus domestic students can opt out, or is it the same criteria?
The insurance is the same. As far as opting out or waiving out, again, domestic students can log into your AU Access and log out in that manner, or international students will have to come to our office and waive out. That's the only difference, really.
And we learned when we sent out the survey that quite a few of our students are interested in dental insurance as well as vision. So a question for UHCSR, can students get dental insurance? And can you give us just a quick overview of, the cost and maybe the coverage of that?
Sure. So we do, and you do have on your homepage an option for you to purchase the dental and the vision insurance. And it's through United Healthcare, not United Healthcare Student Resources. So all the claims are handled through the parent company, if you will, for both dental and vision. When you opt in, you'll have a list of all the benefits that you get from that. So yes, it is available, and it went down this year. It's about $200 and something, I think, a month.
And that's for dental or vision or both?
For dental is like about $200, and then vision is, I think, around that same pricing.
Okay. And I know we have access to the dental plan online. I don't know about the vision one, so maybe we can talk about getting that up online.
Right, yep, absolutely. Okay. And it may be that the committee decided they didn't want to offer vision, but I thought I saw it up there, so we can look at that to see.
Okay, the next questions are more for AUMC and our pharmacy. So students wanted to know, why are the students on the UHCSR insurance primarily required to use AUMC rather than go to other providers?
So the question is why you have to use AUMC, mostly for cost management. We try, so Mandy will tell you, we've tried our best to provide as many services in-house as we can. So, we have lab, we have X-ray, we have IV beds, all of those things that we try to do in-house in an effort to not send you outside unnecessarily. Because once you walk out of the AUMC and get care everywhere else, you're going to be subjected to the deductible, the co-insurance, your copay, all of those pieces, and hopefully you are using an in-network provider. So the advantage to using AUMC, I'm biased, so the first thing I would say is we provide some of the best healthcare in the area. That's number one. Number two, we try to provide as comprehensive a healthcare as possible. And for you, financially, out of pocket, You have no deductible, no co-insurance, you have a $25 copay. That's it. So like I showed in my example, you know, the difference is, do you want to get your care done and pay $25, or do you potentially want to go to the ER and end up paying $300 and something out of pocket? Same problem. Okay, so that's the advantage. There's an advantage to you out of pocket. There's an advantage to the plan because our costs are lower than your typical costs like urgent care and stuff. Our costs tend to be lower to the plan, and we do a better job of managing your costs. If you all missed what Greg had said earlier when he asked his question, on average at other universities that United Healthcare does business with, on average, their premium increases were around 28%. Okay, at Auburn, and I'm going to give Greg credit for the way he handles the pharmacy. I'm going to give my team credit for the way we handle the care at AUMC. Your premium increase has been about 3 to 4% over the full last 3 years. 1% over the last 3 years, and I don't think you all got any cut in the covered services. So you want to pay 28% of 2,000, you want to pay that, or you want to pay 1% more?
I'll add on to that. AUMC is able to control your care as well. If you go to an outside provider and you don't want anybody to know about it, Dr. Cam and his team cannot help you anymore because you're not there. If you're there and you have an IV and you come back in every 3 weeks for an IV, he's going to want to know what's going on with you. So he is taking you under his wing, and AUMC is to be able to keep track of what's going on with you, because sometimes you go to an ER, they do labs, you never hear about it, he never hears about it, but there could be something that's really important and wrong. If he's part of the initial diagnosis, then he can help control not only the cost, but he can help you get to where you need to be in a better place. So I think it's very important to understand that, and I refer it back to a family, but it is like a big family. When you use the pharmacy, when you use the health center, that's really them taking you under their wing and saying, we need to make sure you get well. So I think that's just another kind of a sidebar of not just the cost, but he can then take care of you to make sure you get well. So I think it's really important to understand that, as well as going to an outside provider that's not going to call you and say, how are you doing? Are you doing any better? Do you want to come back in? So I think that's really important. The services they provide are personal and not just a name.
So the next question is, so sometimes students go to AUMC, they get labs drawn. Sometimes they're 100% covered and sometimes they're not. So we wanted to know when labs are considered in-house at AUMC and therefore covered, and when do they actually count towards the deductible?
So we've got an in-house lab where we do a number of the common labs that we need, like CBCs, urinalyses, pregnancy, strep, flu, all of those things are done in the in-house lab. In addition to that, we send anything that we cannot do in-house out to another lab. And it's usually at East Alabama or to Quest or some other company. But under the United Student Health Plan, to make it simple for everyone, we just charge for everything. Correct, John? Right. So we charge for everything, and United gets the benefit, and y'all get the benefit of the discounted fees that we have contracted with the lab companies outside of AUMC. So again, that's all part of covering your costs. So most of the labs, almost all the labs that you will have done, okay, at AU Medical Clinic is going to be covered as in-network and within your $25 copay if there was a visit related to it, okay? So that's typically how that is handled. Now, what might not be covered, okay? Let's say you had an exclusionary situation. So let's say you had acne. Okay, acne is a specific exclusion under that plan. And so if we did labs related to acne and our diagnosis was acne, okay, regardless of who you saw, you're going to pay out of pocket for everything because it's a specific exclusion. That's why when Aime put up the exclusions, it's really important you understand what those exclusions are. So that's typically the time that you will end up paying for a lab, is if it's under an exclusionary situation and it's done at AUMC.
Thank you. So students can get an annual wellness visit as part of the insurance for free. So what kind of things would be covered within that wellness visit? And is there anything that the student needs to do that it is billed as the wellness visit?
Okay. So under the plan, you're entitled to an annual wellness visit. I stress the word wellness visit, okay? So during that, you will get a physical. You will have typically what's checked that you should be up to date on immunizations, like your tetanus shot. Certain vaccines like the human papilloma virus vaccine, different meningitis, all those things are part of the wellness visit, okay? If, however, you make an appointment for a wellness visit, and now you start bringing up, this elbow and shoulder has been bothering me for 3 months, I think I may have broken my foot because I was playing soccer the other day. And in addition to that, I have this lesion here, this skin problem and stuff. That's not a wellness visit. It just went from a wellness visit to a complaint visit, a medical complaint visit. It's not going to be billed as a wellness visit, nor should it be, okay? That's not a wellness visit. So once you start going down that pathway of wanting all these things done, it's no longer a wellness visit, okay? It's now a sick claim or illness visit. So my advice to you is when you make the appointment for a wellness visit, stick to wellness, okay? If you cross over from wellness into a sick visit, then you're going to be subjected to a copay, all of that sort of stuff, and we legally cannot bill it as just a wellness visit. Okay, so wellness visit, anything that typically we do within that wellness visit is a wellness visit, it'll be covered. Unless you start bringing up a bunch of complaints, and then it's no longer a wellness visit. And you don't have to do anything if it's a true wellness visit. That's up to us. We have to know it was a wellness visit. That's what you made for. We stuck within those criteria. We bill it out as a 395 visit. So then it's considered a wellness visit. And that's how, and you don't have a copay, I believe, under a wellness visit. Okay?
The next question is whether AUMC has considered remaining open longer hours, such as on nights and weekends.
We visit, so the question is opening on night and weekends. We visit that process at least every 2 to 3 years. We looked at our volumes, we looked at our usage, we looked at all those things, and we looked at the costs to keep the clinic open, okay? To run that clinic and to keep it open on skeleton staff cost us probably about close to somewhere between $800 to $1,000. It's not just the doctor. You need someone in the lab, you need someone in x-ray, you need someone to check you in, you need someone to check you out. There's at least a minimum. You need a nurse, okay? You need a medical assistant. So right off the bat, just to keep, like we do on a Saturday, just to keep the doors of the clinic open for that extra hour is going to have us use at least 7 to 9 people. Okay, in that 7 to 9 people, for us to recover just that cost, okay, we would have to see probably about 4 to 5 visits, okay? When we do it, that's just to break even, maybe, and it might be more than that as far as number of people. That's just to break even, okay? When we run the numbers, it's just not worth it in our situation to do it. Now, the reason that we open later hours and the reason that we open on Saturdays, historically, you just need to know, I've been running the clinic for 22 years. The reason that we open till 6, we used to open only till 5. And then we opened on Saturdays. And back then we did it because there was not a single urgent care center in Auburn. It was us or the ER. That was it. And the ER, you know, is an expensive form. So we pushed the hour forward and we added Saturdays in an effort to do that. But since there's been a number of urgent care centers and stuff have opened up, you know, the average number of people, right now we lose money on opening on Saturdays. Just about every Saturday we lose money. And it's not unlikely that in a year or two we might consider not opening on Saturdays. But the beauty of us trying to open on Saturdays was that it gave our students access, it gave us some continuity of care, because sometimes we'll see a patient on a Thursday or on a Friday and they need to come back and be reevaluated a day or two later. So that gave us that option. That's part of why we did it. And in addition to that, it cost you all less out of pocket, because if we're not open, you're going to urgent care and ER, you are subjected to a deductible, co-insurance, and higher copays. We get it, but we can't open later.
As a follow-up to that, so what options are available after hours to students on nights and weekends when AUMC is closed?
So when AUMC is closed, if you're part of the United Healthcare Student Program, they have automatically, it's turned on, there is like a telehealth doc system, and it's called telehealth. Really impressive. Okay, telehealth, it's called, it's called, very creative, it's called telehealth. And as a United Healthcare student, okay, you call them, okay, that's what I recommend you do. Now, they have a timeline within which to get back to you. I don't know what that is, but it's a toll-free number. You call them, and then you will be hooked up to a physician. If you're part of the United Healthcare plan, there is no cost to you right now, okay? So that should be your first option. Why should you not use that first? You have an emergency, then you should be calling 911, okay? You have an urgency. Like for example, a telehealth doctor, you split your head open and need stitches, what are they going to do for you? Okay? You break your arm, you call the telehealth, what are they going to do for you at that point? So you got to use a little common sense here. So if it's something, so the first thing, so let me back up for a second. I'm getting ahead of myself. The first thing you have to determine is if we're closed or it's on a weekend, is your problem significant enough that you cannot wait until the clinic opens? That should be your first, okay? So, you know, you start throwing up at 3 o'clock, you know, you're throwing up, not throwing up blood, you're not in severe abdominal pain or something, you probably could wait till 7:45 and come to the clinic. A lot of people do, okay? But if it's a situation where you think, oh no, this abdominal pain is really severe, you know, I can't hold anything down, it's getting worse, and it's 3 o'clock in the morning, go to the ER, right? Or you can call the teledoc. Knowing the way telehealth works, they're probably sending you to the ER then also, okay? But, so first is to determine whether or not it can wait. Second is to use the teledoc. Failing that, then you can go to the urgent care center. Once you start going to the urgent care center, or the next option, which is the ER, just be prepared, there's going to be a out-of-pocket cost for you, okay? Using the teledoc, there's no out-of-pocket cost. Wait until the AUMC opens, there's going to be a $25 out-of-pocket cost. That's it. Going to the ER, whatever it costs.
And I will say that the telehealth is not available during AUMC hours of open operation. So you can't just say, I don't feel like I want to go to AUMC and make an appointment. I'm just going to lay here in bed and call teledoc and let him give me something. That's not going to happen. Your first line of defense is AUMC. The only time it's open is when AUMC is closed. So just
I just want to make that clear, because I don't want you guys to think you can just start using telehealth, because it's not going to be available to you. They will not answer unless it's during non-business hours for AUMC.
We had some more questions specifically related to women's health issues. So there is some confusion about LeeOBGYN and the relationship to AUMC. So is LeeOBGYN actually part of AUMC, and are there benefits to using Lee versus other in-network providers?
We are actually a partner with AUMC. We are not a part of AUMC. So it's actually a satellite clinic for our operation that the main headquarters is in Opelika. But we staff that Monday through Thursday from 8 until 5, and on Fridays from 8 until 12. And so the benefit is that we're right there in the building and we're on campus. So if you use campus transportation, you can get to us. We also, at that, you also can come to either of our other offices if there's a provider that you prefer that is not at AUMC that day but has an opening somewhere else. We do protect some appointment slots on a daily basis that are not used until the day before or the day of, so that we can get you in as quickly as possible. I will tell you, if you call and say this has been going on for 3 weeks, they probably are still going to protect those slots for people that are, have more of an urgent type of thing. But we are going to try to get you in just as quickly as possible. And we also try to work around your school schedule if that's what you need us to do, but within those hours.
We also wanted to know, is the Women's Health Center a part of AUMC, and do the services performed there apply to the deductible?
So Women's Health Services at AUMC, you do have to have a referral to come see us, but you can get that referral very easily from downstairs. And then it would apply to your deductible and that type of thing. The only thing you don't have to have a referral for is for obstetrical care. And if you do need obstetrical care, you will have to go to one of our other offices. We don't do obstetrical care in the AUMC office. No, not for preventative. And yeah, you can come for your annual and you don't have to have a referral. But again, like Dr. Cam said, if you come in and you say, I want an annual visit, a checkup, pap smear, breast exam, and then you start talking about other issues that you are having, that goes from being an annual visit to, like he said, a complaint visit or a medical visit. And so then that would be subject to all the other things, as well as then you need a referral for that. So yeah, so your deductible kicks in then.
We also had some students comment that they had difficulty scheduling with Women's Health due to limited number of appointments. So we wanted to ask, can students schedule an appointments with just a normal provider to receive services such as a birth control prescription or STD testing, or do they specifically have to go to Women's Health?
That would be a Dr. Cam question.
I liked how you moved that over, Amy. That was very slick. So the answer to your question is, again, if it's a women's health issue, we try to partner and work and have LeeOB do that here. There are times when, again, due to their challenges of staffing or due to the demand, like for example, a young lady might come in and she might think she has a urinary tract infection or something like that, and they can't accommodate her that day. We've talked and we'll see you at the AU Medical Clinic. But if you want to be put on birth control and do stuff like that, no, we're not doing that. We're going to send it. Now, on a rare occasion, okay, on a rare occasion, let's say you took your last birth control pill today, or you're going to run out in 2 days and they can't see you for 2 weeks, okay? There are two options. Number one, you can talk to their office. Their doctor or their clinician might be able to prescribe an extra month for you to accommodate when your visit will be. Your second option, which is rare, if you talk to us and you catch me on a good day, I slept really well the night before and stuff, I might also give you a month's worth until you can get in with them. But typically, we're trying to not try to do, what they're doing, because when it comes to birth control, there's so many different options, okay? You have pills, you have IUDs, you have the implant, okay? And then your circumstances that have to be taken into account. Do you have underlying health problems? Are you on certain medications? All of those things. There's a lot of other factors. It's not as simple as just giving you a prescription for birth control. There's a whole series of things that have to happen if you're going to get the right quality care. So I hope that answers your question. We'll work as a backup, but we primarily want your woman's health care done by LeeOBGYN. When they can't handle it due to demand, because again, sometimes their clinicians get sick. Sometimes their clinicians have family emergencies. Sometimes their clinicians, it's like, for example, you want their clinicians to go to, let's say, the big OBGYN national meeting with the latest state-of-the-art information. So sometimes 2 or 3 of them out of 7 of them have to go. Well, guess what? Somebody's got to stay in the hospital to deliver babies, okay? Somebody's got to staff the other offices. So, sometimes they can't accommodate everybody in that limited period of time.
The next question is related to pregnancy. So our referrals needed for obstetrician care, and are students allowed to use an obstetrician outside of LeeOBGYN under the UHCSR insurance?
Let me try and answer that then, and correct me if I'm wrong. So if you know you're pregnant, okay, and you are pregnant, no, you don't need a referral. You just need to go at that point to LeeOBGYN. Can you go to an obstetrician outside of LeeOB? Yes. The answer is yes. But whatever you do, make sure that that obstetrician is in network. Okay, that's the first issue. Make sure the obstetrician is in network. Make sure the hospital that they deliver babies at is also in network. Okay, that's the second thing. So if all of those happen, it doesn't matter whether you go to LeeOB or you go to another in-network obstetrician. The only, so I'm biased. I'm going to tell you I'm biased. Okay, there's a reason why we partnered with LeeOB. They've got 8 doctors now, 8 obstetricians. 7 obstetricians, and then they have the nurse practitioners. They've got a lot more capacity. It's not a 1 doctor only obstetrician or 2 doctor only obstetrician. Some people like that because they think, oh, well, I'll get the same person to deliver the baby. Not always, but it's just that they've got more capability, more capacity, and they practice good medicine. But the simple answer to the question is you can go to a different obstetrician. Just make sure they're in-network and they deliver at a in-network facility. Otherwise, you're going to have a big out-of-pocket cost.
Thank you. We also wanted to know, are there services commonly recommended by an obstetrician which may be rejected by insurance due to billing issues? And this is specifically in regard to some students said that they had denied claims for vaccines received from their OB.
Okay, so I'll try and answer that too, and Mandy can chime in. Typically, it's going to be a Tdap, which is a tetanus and pertussis vaccine, because the obstetricians want to make sure that you have immunity, because pertussis to a newborn could be fatal. So they want to make sure that you, the mother, or your spouse, if you're the father, the spouse needs vaccinated. A lot of times we have grandparents vaccinated, caregivers vaccinated, but definitely the mother. And so the 2 big vaccines that come into play are going to be the Tdap, which is like I said, tetanus and a flu vaccine. And so we've talked to Mandy, but those 2 vaccines should be covered as part of the obstetrical care and visit. And so it was more of a behind the scenes billing issue, but we think we'll get it resolved.
The easiest way to take care of that is, those are two things that you have to have a referral for. So but while you don't have to have a referral for your obstetrical care for the Tdap, you do need a referral. So we can make that happen. We just need to know beforehand that that referral's there.
Or we can give it.
Yeah, or you can just, AUMC can give it. And we try to watch that very carefully. Our doctors don't pay a ton of attention to insurance because they want to take care of you. They don't want to be having to think like way out, you know, the cost or whatever. And so, but we do a really good job, and the two folks in the back that are with me do a fabulous job of putting into place processes so that we're making sure that we're watching for those things, that we're trying to be proactive about those things. So please just know that. And I just real quick want to put a plug in for AU Medical Center. My husband and I are both patients at AUMC of our own choice, not because our insurance says we have to go there, but because we receive such excellent care there and have had such great experiences there. So I do want to encourage you all. And we pay more than $25 when we go. So if you can go there and pay $25, that's like the best deal ever. So.
And we have one more question, and then if we have time, we can open it up to questions from the audience. So there are currently no in-network anesthesiologists and radiologists at EAMC, which sometimes leads to significant
You
costs.
can deliver the news, not me.
Okay, so this has been a recurrent issue, and Mandy and I had a discussion. We've pushed on the insurance committee and stuff. Remember, I explained to you how premiums are decided, what's included, what isn't. Mandy went to bat for y'all. That's a fact. And so she's talked to the underwriters, and so beginning when? Okay, so beginning this coming fall of 2019, this coming fall, not now, this coming fall of 2019, if you get your care done at East Alabama Medical Center, and therefore you have, let's say you needed surgery and there was an anesthesiologist there, or the radiologist at EAMC, they're going to cover it as if it's in network. Okay, they're going, starting in fall of 2019, they're going to cover it as in network. They're figuring out the details. Now, understand, like we explained before, in network means that those doctors agreed to discount. We haven't gotten, they haven't gotten, which is why they weren't in network. The anesthesiologists and the radiologists did not want to contract and probably will not contract with United, okay? So it's going to be factored in your premium one way or the other, but at least all those complaints will go away, which also means you pay less out of pocket at the end of the day, all right? So hopefully that gets solved in fall of starting fall of 19.
That's really good news.
Thank you, Mandy. Thank you. That's been like a non-stop problem.
Okay, so we only have about 10 more minutes. Oh, please.
One of the things you brought up was people having trouble getting an appointment with us. If you are having trouble getting an appointment with us, I want you to email me, because that should not be happening. And as John and Dr. Kim and I will tell you, sometimes things happen that we don't know about unless you tell us. And so my email address is just admin, ADMIN, at LeeOBGYN.com, or you can call the office and ask to speak to me, and they will give you my email address. But I want to know if you're having trouble getting an appointment with us, because like I said, we do protect our schedule over there is built totally differently than at our other clinics. And so please let me know if that's an issue.
Thank you so much. So we just have a couple more minutes. We're going to open it up to questions from the audience. So if you have a question, please raise your hand.
So there's, sure you went. So you mentioned the United Healthcare dental plan, and then there's this handout of various dental plans. Do we just basically get to pick among them based on prices and stuff, and that's about it?
So the Graduate Student Council printed out some of the dental plans in the area. So I think the answer to that question is yes, you can pick if you want to use UHC or other dental plans.
And I'll be the first to say, the UHC plan is not the least expensive, but it's what we have to deal with because it's a corporate plan. So I can't tailor it. I can't do anything different. It's just an added benefit that we can provide to you as an add-on, but it's not something that we absolutely want you guys to purchase because we know there's lots of other plans out there. Delta Dental's out there. There's several others that have, you know, they're less expensive, depending on what your needs are. Because you need to really think about that if you're going to be in braces, if you need crowns, you need to make sure that the plan you choose has those benefits in there and that there's not a really high deductible with it. So just be careful when you start picking out some of the, you know, when you start looking at the plans to determine what is your need and will they cover that need.
Thank you for your question. Are there other audience questions at this time?
I just have a small question. So do you pay a copay on every follow-up? Are you required to pay a copay fee of $25 on every follow-up for a particular disease, let's say?
Yes.
Okay.
Because it's part of our discount on the front end. So classic example,
Let's say a visit was $100. Okay, so let's say a visit was $100. We contracted to only with the insurance company to accept 80, right? So person gets seen, it was $100 charge, $80 was the contracted amount, okay? Your copay was $25. They're going to only reimburse us 80 minus 25. They've assumed on the front end, we are collecting the 25. And so we've already discounted it to start with. So yes, there's a copay on every visit.
I heard with UHC, each year a student can get a free general health screening. And what's the procedure of it and what type of screening we can get from this?
So it depends on whether you're male or female, right? And I'm not going to cover transgender right now, but essentially it's a wellness visit. It's what we were talking about. That annual screening is a wellness visit. So in the case of, if you're a young man, it's going to be you make an appointment with the AU Medical Clinic for a wellness visit, okay? In addition, if you are a woman, you can also schedule an annual wellness visit with the LeeOBGYN group, and you do not need a referral, okay? You do not need a referral. But those are wellness visits. But again, I'm going to remind you, when you go for a wellness visit, don't start bringing up complaints that you've been having, because you're going to switch it from a wellness visit to a medical non-wellness visit. Right. Other questions?
Time for one more question from the audience.
And then I wanted to make one final comment when we finish questions. You too, okay.
Hi, I actually have two questions. First is how much I need to pay for 1 year for the insurance. Second is, can I choose another insurance company?
Do you have an assistantship? Okay, so it'll be 2028 for the entire year. That's from August 16th till August 15th. So that would be for the following year, from August 16th, 19 to August 15th, 2020. What was your other question? Oh, you can opt out as long as it's equal to or better than the insurance that is offered here. That means you cannot have prior issues, like you cannot have a pre-existing condition. That also means your deductible needs to be the same. There are different, are you international, domestic?
I'm an international.
So you would need to come to our office and fill it and sign a waiver form, have the other policy sign a waiver form and claim, yes, they are equal to or better than, or no, they're not equal to or better than, and then we can decide at that point.
So I'm a physician, but I also used to and started an insurance entity. And there are 5 questions that an insurance entity typically will use, And it's the same 5 questions you as an insurance enrollee should use, okay? And the 5 questions are the following. Number 1, are you a subscriber or covered enrollee? That's the first question. If the answer is no, then it doesn't matter what insurance company you're not insured. So that's the first question. The same thing the insurance company does. The first thing they do, they get a claim. The first thing that happens is they check to see if you paid your premium, if you were insured, etc. If you're not, doesn't matter what the claim is for, it's not getting paid, okay? If you don't think that you are, if you check and you don't see that you're enrolled and you should be, you go to Aime, okay? So that's the first question. Are you an insured enrollee? The second question typically is what you think you're going for a covered benefit, okay? If it's an exclusion, doesn't matter what insurance company you are, it's not going to pay for it. Same thing on the insurance side. The minute they get the claim, they said, nope, these codes are exclusions, 0 reimbursement. So are you an insured enrollee? Is it a covered benefit? The third question, for your purpose, is the provider providing the care an in-network provider? Okay. The fourth question, is the care being delivered in an in-network facility? And then the last question, is what I'm asking for medically necessary? If you answer those 5 questions yes, then you're getting the maximum benefit out of the plan, and God willing, you're also minimizing your out-of-pocket costs at that point. If you answer those 5 questions, same thing on the insurance company side. They ask those same 5 questions. They interpreted the information differently. They have a different process, but the same 5 questions are asked, and you should be asking yourself those 5 questions. And that will solve a lot of your issues on the front end.
I just wanted to add one thing, just so you guys will know. Adding on to Dr. Witte's comment about the assistantship, I'm glad that they're raising that, but also just keep in mind that that's only for the students. It's not for your dependents, not for your spouse, not for your children. It's strictly just for the student. So if you do receive a $450 fellowship assistance stipend subsidy, it's strictly for the student, not for anybody else but that person. That's all I needed to add. Thank you for the information.
Thank you so much to our panel for being here today. They took time out of their busy schedules to help us better understand the insurance. This concludes the portion with our experts. Now we're going to transition into a graduate student only session. There will be food provided. We ask you to please stay. If you haven't signed in yet, please sign in at the back. There are also some handouts available for you.
Thank you all.